Okay, I'm Jorge Alió. I work in Spain in Alicante. I'm professor chairman of ophthalmology in Miguel Hernández University. My main areas of expertise are refractive, cornea and cataract surgery, ocular surface and intraocular inflammation. Refractive surgery has been positively influenced by many improvements in technology, in the diagnostic equipment that we use for the selection of patients, and finally because of the information provided by the long history that we have already in the background of many techniques like in LASIK or the use of lenses. So the most recently remarkable are definitely those related to the development of intrastromal laminar extraction, SMILE, because it has opened a new possibility of treating the refractive errors without the flap, which was one of the reasons of many problems that we had in the past. Even that LASIK is remarkably safe today and very precise. The second probably is in the area of presbyopia developments. The presbyopia is still an unsolved problem, but we have better solutions today thanks to the creation of ablation profiles, the cornea called PresbyLASIK, and PresbyMax among most of them, and others developed for the purpose, and the use of multifocal lenses for the correction of presbyopia, both in phakic and pseudophakic conditions. And one of the main issues in this meeting is the recent development and outcomes that have been reported about the use of phakic multifocal lenses for correction of presbyopia. Okay, we have today, as usual in medicine, many accomplishments, but many things that are still to be solved or to be accomplished. The first one is the solution of presbyopia. Presbyopia is universal. Billions of inhabitants in the world are affected by this problem and will be affected even more in the future because the aging of the population is obvious. And so the solution of a problem that all the people is feeling as an inconvenience, it creates a dependence on glasses, it creates a change in the style of life of many people, and these are really inadequate and badly received and welcome problem in many people. So the solutions are at this moment basically surgical, the use of some non-surgical approaches like the use of drops. Eye drops is really a very high expectation from this moment, and also the development of real accommodative lenses that indeed are the ones that will replace eventually multifocal profiles. Having said that, what I say to my patients, I say, and in my opinion with the patients, I have to be very honest and to say which are their expectations that I can match with my procedures. I want to make them aware of the limitations that we have. We are not God, we are doctors, we have a lot of resources, but we cannot fix any problem, but we can fix most of the problems today. So the good news for refractive surgical patients, I can hardly think in a patient without a real solution for a refractive error as far as has a normal or almost normal eye. I can hardly think in a complication that cannot be fixed or modern corneal refractive surgery. LASIK is tremendously effective and safe. We have a history of 25 years, but the recent history, and it was one of the presentations I made today about the use of LASIK in high myopia, is remarkably safe, stable, much better than before. And then we have these emerging techniques of intracorneal lamellar surgery, like SMILE, that in my opinion promise a huge future of application in the future, not as an alternative to LASIK, but probably complementing LASIK for some specific topics. Okay, the future is, in my opinion, very positive because we are at this moment in an emerging moment in different technologies, both pharmaceutical and technological and surgical. From the pharmacological, in my opinion, the future potential use of drops to compensate, to correct, or to control presbyopia is amazing because most of my patients, including myself, would love to have one drop in the morning or one drop twice a day and to avoid surgery, at least for some years in which I can be really doing very fine. Some evidence indicates that we are nearby to accomplish something like this in the following years. These are major accomplishments. Second, when we have a real advanced presbyopia, or we are targeting the correction of far vision problems like hyperopia or myopia in presbyopic age, to have the availability of faking multifocal lenses is indeed something that will be tremendously attractive, because before removing the lens, and at the age of 40, 45 is not the age to remove a lens now in a normal patient. Definitely we have this as an alternative that in my opinion will bring tremendous satisfaction to patients and doctors once that the outcomes are proven and are effectively developed. And finally we have a new wave, which is the joint between the corneal surgery and emerging procedures, especially regenerative surgical procedures of the cornea with refractive surgery, with the use of lamellars, lawyers, without cells of cornea, with some refractive power that probably can be the solution for those cases in which we want to have a kind of conservative approach. We don't have a big problem to solve, but basically we don't want to create a permanent change in the cornea of the patient, because they should be removable, and definitely the inlays that formerly were used are going to be totally substituted by this new generation of real corneal devices manufactured with real cornea from human origin or other origins, but definitely without antigenicity and without cells. Well, this has been a remarkable meeting. Actually, we are in the meeting still today. But finally, I think that the interaction with many doctors from different countries, you can perceive a lot of what is happening worldwide. This is the advantage of World Ophthalmology Meeting. There has been many presentations worldwide, important, and the most attractive ones for me has been those related to the use of new intraocular lenses for the correction of presbyopia, again, phakic lenses, the real alternative that we can have for pseudophakic patients of new accommodative lenses, with data that has been provided during this meeting of lenses that are using the sulcus as a placement for the lens, with remarkable effects on accommodation. They are already proven by facts, papers, and with data. But then we have this type of new corneal devices that are based on the use of human cornea for refractive purposes, but without antigenicity. They are going to replace the intracorneal inlays that today are around, because they are going to be much better tolerated. Still, we have data, and we need data about the long-term or intermediate-term evolution. And finally, we have the different options for presbyopia, both for pseudophakia with modern intraocular lenses, and in the cornea with different uses of multifocal profiles and different types of approaches as well from the pharmacological perspective.